Hi everybody, it's Dr. Michele Drake here, and I'm here to answer questions about vaccines you may have. And Nicole, my assistant's going to start with asking me some questions.
All right, Dr. Drake, when does my puppy or dog need to be vaccinated?
We want to start vaccines on your puppy as soon as you get your puppy. And the reason is because the mom transfers immunity to the puppy while they're nursing, but as soon as they stop nursing, they need to be vaccinated every 3 weeks until they're at least 4 months of age.
Okay. How many times a year does my dog need vaccination?
In general, most dogs should have an update of some vaccines once a year. There are some boarding facilities that require Bordetella every 6 months, and so we may need to see you mid-year, but for the most part, once a year is adequate for most dogs, and even some of the vaccines, we can extend the time a little bit after a year. Rabies can go to 3 years in some states, and I think in other states it's annual, but anyway, it's really important just to check in with your veterinarian once a year and make sure you're up to date on all your vaccines.
Can there be any variations in the puppy and dog vaccine schedules?
For the most part, every puppy needs the core vaccines every 3 weeks until they're 4 months. And then the rabies vaccine sometime between 3 and 4 months. So that's pretty standard, but there are some dogs that are going to be exposed to different things. If your dog is boarding a lot or going to daycare, we highly recommend the flu vaccine for dogs also because it's transmitted aerosol. Bordetella is not considered a core vaccine, but really important if your dog is out and about. And then there's leptospirosis, which is another important vaccine, and it kind of depends on the lifestyle.
Is it safe to get multiple dog vaccinations at the same time?
Yeah, really every dog, 99.9% of all dogs tolerate all the vaccines at one time, just like kids do. Just remember when you have babies, they get like numerous vaccines and they're brand new infants, which to me is amazing, but dogs really tolerate it and cats really well. There's an occasional dog that's a little more sensitive to vaccines, and we may pre-treat or spread them out for that dog in particular. Or if clients have certain concerns, you always work with anybody.
Okay. What is the titer testing and is it effective?
The titer testing is a way of checking to see if your dog actually has antibodies for distemper or parvovirus, and it allows us, as dogs age and they've been vaccinated thoroughly through puppyhood and for sure at their 1 year, there are some dogs that can mount a longer term immune response and some people that really don't want to vaccinate them, or there's occasionally a medical reason we don't want to, but we really want to make sure that those dogs have adequate titers, meaning that they're able to respond if they were exposed. And that's the purpose of doing annual titers on dogs who are not being vaccinated. Because if they do dip low, then we're going to have another conversation about the importance of keeping them up on those vaccines. Because those diseases are terrible.
All right, last question. Does my puppy need to restart boosters if they miss a vaccination?
No, really, we don't want your puppy missing vaccines because we don't want them to be exposed. But for the most part, we just start back up every 3 weeks until they're 4 months. So again, there's not a number of vaccines you're supposed to get. It's just staying on that series. So if somebody found a puppy at 3 months of age, we're not going to go back and start, vaccinating as if they were 8 weeks. It's going to be, every 3 weeks until they're 4 months. So if they get one under 4 months, let's say 15 weeks, I'm going to recommend they get an additional booster to make sure they're safe for the next year. So if you have any other questions about vaccines, make sure you contact us at the Drake Center.